A blood test aimed at detecting whether or not you've already had COVID-19 is now available to buy online. You don't need a doctor. The test comes straight from the Quest Diagnostics lab. So what will it cost? Well, $119. KCTV5's Leslie Aguilar talked to doctors about whether it's really worth the money. Leslie.
Well, getting the test is simple as adding it to your cart online. Then questions will pop up, making sure that you haven't shown any COVID-19 symptoms in the last 10 days. Once you've paid for it, you can make an appointment to get your blood drawn. Then you can see your results later online. We wanted to know how much peace of mind those results should actually give you.
There are several inherent problems that we are continuing to see with antibody tests.
Dr. Dana Hawkinson with KU Medical Center says there are a lot of unknowns when it comes to COVID-19 antibodies. Chief among them, whether or not having the antibodies in your blood means you have immunity.
We would hope that in the near term, 3 months, 6 months, maybe a year, you would have some immunity. But there is no evidence right now to suggest that everybody who has seen this infection will have immunity to this infection.
He says it's also unclear how accurate the antibody testing is. There have been false negatives reported in some antibody tests and even false positives. Some people who have had one of the 4 common coronaviruses may have antibodies that some tests can mistake for a previous COVID-19 infection.
Even some good labs may produce tests that aren't fully validated or vetted.
Dr. Hawkinson couldn't speak to the specific test being offered nationwide by Quest Diagnostics. The price tag for it is the same as a week's worth of groceries for a family of 4, several tanks full of gas, or 10 months of a Netflix subscription.
I wouldn't be willing to pay for it myself, no.
I wouldn't pay for it. I know people throughout the country would definitely pay for it.
People like Mike McGanley would consider it because he and his wife were sick with COVID-like symptoms back in February.
It'd be nice to know, on a test like that, if we actually, had the disease and that we may be somewhat immune to it going forward.
Is that possible?
Yeah, it's certainly possible. If this were 2 or 3 weeks ago, I probably said, well, probably not.
Antibody testing will likely give more answers in the future as to when exactly the virus started spreading locally. Dr. Hawkins says at this point, though, the accuracy just isn't there.
In the current state as we are now, there's probably not a lot of individual benefit to doing that test. Even if it is positive and it's true that you did have COVID-19 and not one of the other common coronaviruses, then again, we still don't understand that you are fully immune. So it's not really a test of immunity.
Now, if you were diagnosed with COVID-19 and you've recovered, your blood and the antibodies in it could be used in a trial with KU Med and the Mayo Clinic. So if you want to be involved in that, you can contact the Community Blood Center. What they're doing is treating patients with COVID-19 with the plasma of those who have recovered. Reporting in Mission, Leslie Aguilar, KCTV 5 News.
Thanks, Leslie. So interesting.